I'm the face of Black Maternal Health, and my name is Dr. Kendra Ivy. I'm a member of the Association of Black Cardiologists and currently an internal medicine resident physician at the Morehouse School of Medicine in Atlanta, Georgia. All people, including those who identify as lesbian, gay, bisexual, transgender, or queer, including LGBTQ, need sexual and reproductive health care. Unfortunately, the healthcare system in the United States has historically failed and largely continues to fail in serving the LGBT community. And specifically, people within the Black LGBT community experience major disparities in sexual and reproductive health care. These health outcomes are far worse than the white heteronormative population overall. The differences are due to a series of structural barriers in the healthcare system, including fragmentation of health services, discrimination from providers and insurance companies, which can then further be exacerbated by racism and other forms of prejudice, such as prejudice against transgender or non-gender conforming people. Specifically in my circle of friends, I've seen gay couples face tremendous hurdles as it pertains to family planning. All these families want is to pour their love into a new life, but navigating this process within a system that's just not designed for them can be devastating. As couples first think about conception, the first hurdle is usually just finding a provider who they feel safe with. And it's not as easy as it seems. There are organizations out there already in place to help us navigate this process, but it can be difficult and just very scary because of having spent a lifetime being judged by providers. Another hurdle is the cost of having a child. For many people, just the expected medical route is not an option. It's incredibly expensive and the money's just not there. I've had friends tell me that they've had to choose between having a child and being able to afford their mortgage because basic healthcare services for gay couples are just not covered by insurance. There is so much work to be done to ensure that the people of the LGBT community have the resources, information, and care they want from a culturally competent, affordable, accessible, and inclusive sexual healthcare system. But there are signs of progress that we've seen. Increasingly, healthcare providers and administrators are starting to integrate sexual and reproductive health care for LGBTQ patients into their practices in order to break down these silos and ensure access and excellent care to everyone. Something that I've seen recently and have just been so proud of at my home hospital, I've seen many providers wear either pride flags or little notes on their white coats and IDs that say, "I'm an ally." Just this small act is a tremendous step in the right direction for patients because they know that they can feel safe in seeking care from us. This small act can be truly life-saving for people. And I'm happy to be a part of it and happy to be seeing it. I am Dr. Ivy and I'm the face of Black Maternal Health.